Hello, my name is Dr. Dan Hebert. I'm the owner at Duxbury Animal Hospital, and I'm here today to talk about one of the pieces of technology that we have here in our surgery suite. Like all of the equipment in here, this is meant to make surgery better, faster, and safer for your pet. And this particular piece is called a vessel sealer. As the name implies, it seals vessels. It can be blood vessels, lymphatic vessels, just anything that we would normally have to use a suture to tie off. So the question that many people ask is, why would you need to replace suture? So first of all, these units were meant for laparoscopic procedures. So procedures where we have to make just small little puncture holes in the abdomen and go in to remove a gallbladder or some other organ. And it makes it very difficult to go in and actually tie off sutures. So they have these little clamps on the end that will go in, crush the vessels, and then electrically will seal them up. The next question people may ask is, if we're not doing laparoscopic procedures, why are we using it on things like neuters and spays and that kind of thing? Well, the reason is sutures are not as great as you would think. Even though you would think that a nice solid tie-off would be better, first of all, it takes a long time to do that. For any particular blood vessel, we have to tease out that blood vessel from the surrounding sheets of tissue, get the ligatures across that, tie it off, and we usually have to do that 2 to 3 times to make sure that we have enough backup that we won't have any extra bleeding after the procedure is complete. The second thing is, despite all that backup, we can still have ligatures that will slip. So as tight as we get these sutures across, the tissue within can still continue to kind of crush over time, and that loosens the sutures and they will slip off, and we can have post-operative bleeding. The third thing is, suture is foreign material, and we're leaving it in the belly after we're done tying off these blood vessels. So that can lead to long-term reactions down the road. So the way that these work is, like I said, the units will go in and will clamp across the blood vessels and crush them. We then hit a button, and then the electrical current will go across these little electrodes on the inside and actually create heat that will shrink up the blood vessels, kind of like shrink wrap on an Easter basket. Unlike a suture, which could slip, once we take this off, what we see is what we get. We know that it's sealed up. On top of that, the machine itself senses when it's sealed off the blood vessel, and that's when it will stop the current. When we're done doing several of these to make sure that we've really sealed off the vessels, we can then hit this little trigger here at the bottom, and that sends a blade back and forth down the end here in the middle, and that will actually cut the tissue so we don't have to pick up a second instrument to try and cut it. So very fast, very easy. And I will demonstrate it on a piece of chicken skin. So like I said, a lot of blood vessels are actually within sheets of tissue within the body. So we can actually do several blood vessels at once with this. So we put it across, and we hit this button. It'll beep and then give us a long beep when it's actually, it knows when it's done. When we take it off, like I said, you can see that it's actually shrunk that area down and created a seal. So I said we can do that 2 to 3 times, and then for the final one, when we do the seal, we can then hit this trigger, and that will actually send that blade back and forth, so when we let go, it actually cuts it for us as well. So saves a lot of time, much, much safer for the patients, and a much better option for when we're not doing laparoscopic surgeries. If you'd like to learn more about some of the other pieces of equipment in this room, please check out our website with some of the other further videos. If you have questions about anything that you saw in here, please give us a call anytime. Our number is 781-934-5300. Thank you.